Okay, thank you. Good afternoon, everybody. Thank you for being here this afternoon with me. I will be sharing with you some information based on the pharmacy profession in general and about the opportunities that it offers. Let me give a brief introduction of myself firstly. My name is Genada Sinani, as you already know. I graduated in 2010 with a degree in pharmacy from Gazi University in Ankara, and later on completed my PhD based on nasal vaccine carriers in the Department of Pharmaceutical Technology at Istanbul University. At the moment, I'm working in the Altınbaş University in the Department of the Pharmaceutical Technology, where I'm giving lectures especially based on pharmaceutics. Before we move on to the different aspects of the pharmacy profession, first of all, I want you to introduce to the word of the pharmacy as it started many years before. Semanu Hanım, please, can we move on to the next slide? Okay, thank you. We are used to the word pharmacy actually in our daily life, but how was it first introduced in the practice and when? Actually, the word pharmacy was coined from the Greek word pharmakon, which means drug. We mostly in the pharmacy profession understand with the word drug a compound that is used to diagnose or treat a disease or a condition, a specific condition for the patient. But a part of this context, drug sometimes can be used as a toxic compound as well. And that's the reason that if you look back at the physicians and to the scientists in the ancient time, here is the importance of the dose when we talk about the drug. As stated in the quotation of the dose makes the poison, it reminds us to use the appropriate dose so that the dose that will be used will not give rise to any harm or any unwanted side effect or conditions when it is used by the patient. And this reminds us to always balance the benefits and risks for diagnosis and for treatment so that when the medicine is administered to the patient, as the first rule, it does not do harm. In Latin, primum non nocere. Next, please. How it all started is the pharmacy profession like it is in our days many years before. Actually, if we look back at the ancient time, we can clearly understand that the ancient people as well had knowledge or medicines, had medical knowledge and already started to write the medical knowledge, like the example that is given in the figure when there are pharmaceutical texts written on the clay tablets. And a part of that, during this time, actually, the role of the pharmacist and the physician was not clearly distinguishable. The physicians, at the same time, used to prepare and dispense the medications as well. But as the time went on in the 19th century, the role of the physician and the pharmacist changed, with the physician being the person responsible for the diagnosis of the diseases and pharmacist the person responsible for the preparation and administration of diseases. What we say in pharmaceutical terms, the role of the pharmacist was in compounding the medication. In the 20th century, especially after the world wars, there was an increase in the mass production, there was a mass drug production, and the role of the pharmacist in pharmacy practice started to change a bit, from just being the person who compounded the medication, but also being the person that delivered pharmaceutical care. And as you can see in the picture, there is the early advertisement made in the field of medications manufacturing in the company. It's one advertised related with the aspirin, one of the very early manufactured in pharmaceutical industry medications. How is today pharmacy, and what are we waiting, or what can be the possibilities that the pharmacy profession offers in the future? Although just looking at the way how the pharmacies used to be years before, like the one that is in the slide, the one in the upper part of the slide, we can clearly see that there's not just the inside of the pharmacy that changes, but we can see and we can conclude that the pharmacy profession is transforming and growing, and a part of just compounding the medications and a part of just dispensing to the patients the medications that are already manufactured in the pharmaceutical industry. In our day, tailor-made medications are gaining importance, and there is an ever-increasing pharmaceutical industry and biopharmaceutical biotech industry that offers opportunity for pharmacists and for other professions that are closely related with the manufacture of the drugs. Next, please. We are used to the snake actually when we are talking about the pharmacy profession and also about medicine. Around the world, if you have a look at the history of the symbols that have been used through the years in this context, we can see that there are many. We just can define the symbol of the pharmacy in just only one. There are different periods in history where different symbols have gained importance, but one of the earliest symbols that have been used and related not just with pharmaceutical profession, with the pharmacy profession, but also with the medical, with the medicines is the rod of Asclepius, who is in the history shown as the god of medicine. And the symbol of snake, both in the rod of Asclepius and also in the bowl of Hygienia, is especially important because by the time the snake was accepted as a symbol of wisdom and immortality. And the bowl of Hygiea that we see as the second symbol given in the slide actually is used in our days as well. We can see the symbol also in the sign of the Turkish Pharmacist Association, and there is a close relationship actually with the Hygiea. The word hygiene that we are actually using in our days has its roots from the name of the daughter of Asclepius, so who was named as Hygiea. Greek cross was used widely, especially in Europe during the 19th century. Especially the color of green was chosen to distinguish it from the red cross that was used by the time in Europe, especially. In Turkey, it's not widely used, but you can find in some pharmacies, especially in areas that there is a high number of visitors annually. And moving back into the traditional pharmacy, we can see the symbol of the mortar and the pestle, which is closely related with the compounding in the pharmacy profession. Actually, this is a symbol that is used in nowadays as well, both by the pharmacists and also by other people or other persons that are dealing with the compounding of the medications in case of cosmetics. The E logo, which stands E as the first letter for eczane, which is the word of pharmacy in Turkish, it's a symbol that is used, it's a symbol that actually we can find in every pharmacy in Turkey in our days. But as I said, the green cross is the symbol that is widely used in Europe. Yes, next please, Samanu Hanım. Let's talk about the famous pharmacists in history. Actually, there are lots of people who contributed in medical science in general. I just try to summarize three of them who I think pioneered very important parts in the pharmacy profession. One of them is the German pharmacist Sertuner, who pioneered alkaloid chemistry. In 1805, he discovered morphine. And we have later on in 1892, Felix Hoffmann, another German pharmacist, who made it possible to synthesize salicylic acid, or what is known in our days as aspirin widely. It was important because actually salicylic acid was used, but it was prepared, it was extracted, obtained from trees, from the willow tree. So synthesizing the compound, it gave possibility to have the compound produced in higher quantities so that more people could reach to the medication. And although it's not a drug, the invention of Coca-Cola was made by an American pharmacist, actually, John Pemberton, in 1886. Normally, he prepared the drink, the beverage, as an alcohol-based drink to use by himself as a painkiller, but due to regulations of the time in America, he just changed its content using carbonated water and started to sell the beverage near the pharmacy that he was working. And it appeared that what we know today as Coca-Cola appeared to be a hit drink that is widely used worldwide in our days as well. Yes, Sema, next please. What is pharmacist actually? If you just go on the internet and search of the definition of pharmacy and pharmacist in different books, in different websites, you are going to find various definitions. Actually, I picked the definitions from the well-known Britannica because it encompasses lots of information related to the pharmacy and to the pharmacy profession, indicated that the pharmacists are the persons responsible, are the persons who have the necessary knowledge how the drugs work in the organisms, are the persons who have the knowledge to convert these drugs into a medicine so that the patients can use. Let me remind to you that the number of the drugs that we are using as powders is very limited, and in order to have a successful treatment, the drug has to be converted into a medicine of what is also named as dosage forms, like tablets, capsules, or solutions. And before marketing these formulations, these dosage forms, there is again the pharmacy profession that deals with the analysis, with the quality attributes of the dosage forms, and not only, again, the pharmacist profession offer the opportunity to give to the patients the necessary knowledge that they use the medication in a way that it shows the intended efficacy. Next, please. Also, typically, we are relating the pharmacy profession with the dispensing of the medicine. We can clearly say that the pharmacy profession has transformed and has become bigger, has changed through the years. We are moving from the typical pharmacy practice to the modern pharmacy practice. More and more patient-centered care is intended, and considering that there is an aging population, lots of people are using more than one medicine, and knowing that there is a higher number of medicines being used, the probability that these medicines show interaction with each other is high. So there must be somebody who monitors and who ensures that even in cases when multiple medications are used together, they are used in a way that they ensure the maximum efficacy with the less possible side effects. And although the technology lately offered the opportunity to combine together different ingredients, different chemicals in one pill, like in the one that you can see in the picture, it's not possible to say that it's a solution to polypharmacy, because it's not possible to always combine the medications that one patient must use in one pill. Moving from the typical pharmacy practice, we have to consider that as the time goes by, people are paying more attention on products known mostly as cosmetics or dermocosmetics, considering that each day lots of people are looking for medications for the dry skin. They are looking for medications that show anti-aging effect. They are looking more a part of the products that they can find in the cosmetic store for the products that are found in pharmacies, and they feel more comfortable to use the products that are advised by the pharmacist. And here's the place where, again, the role of the pharmacist is important in the pharmacy practice. Even though in nowadays the use of the 3D printing is limited just for pharmaceutical industry, we already have in the market a tablet formulation that is prepared using 3D printing, that is manufactured using 3D printing. Maybe in the near future, we are going to have 3D printing of medicines in big community pharmacies as well as hospital pharmacies. And why not? In order to increase the efficacy of treatment, maybe we are going to have pharmacogenomics involved more when the medications are given to the patients, and more personalized medicine will come into use. And as all of this modern pharmacy practice evolve, the pharmacy profession has to transform and to grow so that all the pharmacists catch up and be familiar with the new methods of technology. This does not apply actually just for the pharmacy profession, but it's my opinion that this is something that must be provided and must be done by the other professions as well, considering that technology, the role of technology in our life is increasing. Next, please. In terms of pharmacy practice, there is the star pharmacist concept that was introduced firstly by World Health Organization. Normally, the World Health Organization introduced this concept as 7-star pharmacies, but later on the researcher and the entrepreneur star was added. The overall idea is that the pharmacist is the person that gives care with the name as caregiver. He is a manager managing the drug therapy that the patients are taking. He or she, of course, is a lifelong learner, is the person that needs to make decisions to using the reliable sources about the medications that the patient are using. He's a communicator, considering the role of the pharmacist as a bridge between the physicians and patients. It's a teacher not just for the patients that he communicates with, but also considering academia. He's a teacher because he or she gives education to other generations of pharmacists. Of course, we are leader not just in the professions that we do, but in our daily lives as well. In the context of the pharmacy profession, the pharmacist is a leader instructing the patients how to use the medications, and takes important role in the research and development of new dosage forms, and also plays a role as a researcher to analyze the results related with the use of the medicines. Entrepreneurship actually was one of the last stars that was added in this concept, because the trend is that pharmacists, the pharmacists that are graduating mostly are following areas of pharmacy that they are familiar with, and there is a very limited number of pharmacists that does not want to take risk and be an entrepreneur. But I hope that in the very near future, if we can coin with the term as pharmapreneurs, the number of the pharmapreneurs will increase in the very near future. Yes, next please. As healthcare providers, in order to make it possible the safe administration of the medicine, what can be understood by the right medicine in the right dose, using the right route, delivered to the right patient at the right time. It's important that pharmacists, doctors, nurses, and also other healthcare providers work together so that the patient gets the medicine in a safe way and in a way that it's effective. I most probably I believe that lots of you most probably watched Dr. House, as it can be shown in the picture in this episode. You can just Google in the internet as well, like Dr. House and inhaler. In order to avoid the situation that is given in the film, we have to combine and communicate with all the other healthcare profession to ensure the safe and effective administration of products, of medicines to the patients. Overall, this is a recent study that has been published this year. You can find the reference in the slide if you want to have a more detailed information. The study shows that pharmacists are a key personnel in the healthcare system, considering that according to the surveys, according to the study, the patients visited community pharmacies more often than their primary care physicians. So they say in Turkey as well that the pharmacist is the first person where you can get advice related with health, and actually it's the same worldwide. And this study also emphasizes the key role of the pharmacist in the overall healthcare system. Yes, next please. It's not all, although in our daily life we are familiar with pharmacy practice, and in general when you ask to not just pharmacy students, not just to pharmacists, but also to the people outside the field what pharmacy is, most probably they are going to give examples related with the application of the profession in community pharmacies or hospital pharmacies. But the pharmacy profession, actually, it's a very lucky profession because it has lots of diversities in it. In our days, a part of the hospital pharmacy, there is also an increasing role for nuclear pharmacy as well. And the part of the community pharmacy and hospital pharmacy, the applications of the pharmacy in clinic are gaining interest as the time goes by. So there is a new opportunity for the pharmacists to work as clinical pharmacists in hospital together with the doctors to deliver the right medication to the patient and to monitor the therapy. This is not only the only field that the pharmacists can work. The pharmacists can also work in academia, and they can be involved in activities related with teaching and related with research as well. There are the government agencies in Turkey, like TİTCK, like EMA in Europe, like FDA in Europe, and not only, there are government agencies that are related with the reimbursement of drug, of medications, where pharmacists can work, and there is an enormous area in pharmaceutical industry. Yes, please, the next. There are different departments in pharmaceutical industry when pharmacists can work, like the research and development, manufacturing, the quality assurance department, there is the regulatory affairs department, there is the marketing department, as well as department that relates with the monitoring of drug effects after they have been approved for use in the market. And we really need this part of profession because, as I said, especially nowadays, pharmaceutical industry is the place where the drug is converted into a medicine, and it does not end there. It also deals with approval and also with the monitoring of the drug, and it is being used by wider population. Until lately, actually, we were talking about the manufacturing of what is known as small molecular drugs. If I'm going to give an example, aspirin, but considering the developments that are being done in genetics as well. Today we are talking about biopharmaceuticals a lot. These are proteinic molecules with high molecular weights that offer opportunity to treat diseases that are not yet treated by conventional methods and conventional medicines. And this field also offers opportunity to pursue a career, a part of the conventional pharmaceutical industry, a part of traditional pharmaceutical industry that we are mostly used to. But as you can see in the picture, the environment in the pharmaceutical industry is a bit different, different from the environment in a community pharmacies. Unfortunately, there is a very limited number of pharmacies that pursue a path in pharma industry, but studies that are being carried lately show that there is an increase of students that think to change the typical job of working in a community or hospital pharmacy by moving and pursuing a career in pharmaceutical industry, either if it's the industry related with the production of small molecular drugs, or either if it is big pharma, or the industry related with the production of biopharmaceuticals, including vaccines, including the production of antigens. Yes, please. So there are lots of possibilities that we come across. How can we find the right path? Sometimes the path that somebody follows may not be good for somebody else. So the best option is to make a choice that is based on the experience of everybody. Next, please. And there is a wide concept used in nowadays, known as Japanese concept of the Ikigai, which instructs that in order to find a profession that you really like and you really feel fulfillment, you have to overlap your mission with what you can be paid for. You have to consider what you are good at. You have to consider what you love, so that when you find the intercept of all of it, you are going to have a bright future and you are going to feel happy. Actually, there are lots of arguments if following the passion gives the opportunity to have a great profession. Some people think that following the passion gives the opportunity to have to be successful in the job that you do, and some other persons think that the passion can be developed on hard work, because when you work hard on something, you start to love more what you do, and that passion inspires you to be successful in what you have decided to follow and what you have decided to do. On a personal level, I believe that hard work can inspire a passion as well, and can lead to a successful career as well. Yes, please. How is the future of the pharmacy? What is the way that a pharmacy graduate has to follow so that he or she can feel fulfillment in what he or she does? We have to consider once more the transformation and growth, as shown until now, all the stages that the pharmacy profession has gone through, and not only the pharmacy profession, but lots of professionals transforming and growing. And we have to consider this transformation and this growth as opportunities, not just during the pandemic that we are in, but lately there is an increase in the concept of digital health. And here we have to think if not just digital health, but also digital pharmacy will reshape the future of pharmacy. Again, if you just go on the internet and search on pharmacy Amazon, you are going to see that Amazon is also dispensing the medications in America. So there is the question, will it affect the pharmacy profession? Will it decrease the role of pharmacists? What will be the need of the pharmacist in the future? Or will just pharmacists feel happy by working in the pharmacy provided by Amazon as well? And in this context, we have to consider Amazonizing pharmacy for the future. Either it will be good, or either it will be bad, or either it should be stopped. And as I shortly introduced earlier, will 3D printing say goodbye to mortar and pestle, which is also the symbol of traditional pharmacy? And will the pharmacy profession and will the pharmacists welcome 3D printing? There is always a need of new medicines, and there is always a need of new vaccine, because the battle with diseases is endless. And as in the pandemic that we are in, there is an ever increasing number of diseases that can threaten our lives. So there will always be a need for the discovery of new medicines and new vaccines. This field offers another opportunity for pharmacists to work in and to develop themselves in the future. The technology related with the biotechnology, actually, the biotechnology impact is affecting not just the treatment of the diseases, but also vaccinology. Up to now, there was not any vaccine produced using the mRNA technology, but in a very short time, very quickly, the scientists could get very promising results using a very new vaccine in the area of vaccinology to provide immunization against the virus that is threatening human lives at the moment. And here comes the question if this technology will also change, and if this technology will start a new area in immunization and in vaccinology. The questions are endless, considering that lately we have the medications, the OTC medications, so over-the-counter medications, as well as some other products related with health sold in the markets, like the example that you can see in the slide, Migros and Zana, where the traditional symbol of the pharmacy profession is used, the mortar and the pestle. So it has to be discussed if this is appropriate or not, since the patients in this context cannot get medical advice for the medications that they choose to purchase. The same applies for the pharma box that you can see in the picture. There are these boxes that are developed so again that the patient can get the OTC medications, again by not taking any medical advice. All of these situations have to be evaluated so that the accessibility to the right medication at the right time is possible for all the persons seeking help and seeking medical advice. But in any case, we can say that the pharmacy profession will transform and grow and will renew itself so that it can comply with the conditions of the new applications that will be done in the pharmaceutical and also in the medical field.
By the way, I'm breaking, sorry, Miss Genada. We have just only 4 minutes. Yeah, okay.
Okay, I'm about to finish. Okay. The process of learning never ends. This is the concept of lifelong learning developed by WHO, by the World Health Organization. First of all, in order to improve our knowledge so that we can consider the new opportunities that life and the profession offers, we have to recognize the gaps, to plan how we can reach the knowledge, and also to integrate what we have learned in the necessary areas, to evaluate the knowledge that we have gained based on the experience, as well as reflect again and recognize always if we still have it. And as we go on actually in the cycle of lifelong learning. Next, please. Yes, I wish that everybody chooses a job that he or she loves, that they feel fulfilled, and that everybody has a bright future. I thank you all for joining, and thank And thank especially to the healthcare providers, to the pharmacists, doctors, and nurses that are trying to help and to save lives all around the world. Thanks for joining and thanks for sharing this afternoon, for spending this afternoon with me.
Thank you very much.
Thank you.
See you. Bye.
Bye.